And thinking about the Ebola outbreak that's occurring in Africa right now, it's a novel virus of Ebola. Can you provide an overview of this particular strain and what makes it so particularly concerning?
So the Ebola that we mostly hear about is a strain, if you will, of Ebola called Ebola Zaire. And that's what most of us hear about and heard about in the past with the big outbreaks, including the one in 2014 through 16 that infected almost 30,000 people. This is the Bundibugyo virus. It's a strain of Ebola. It's not so much that it's novel. It existed for years. We've known about it. There are different strains of Ebola that have been around for a long time, including Sudan, Bundibugyo, Reston, Zaire. So it's not that this is new or it mutated from the West African outbreak or something like that. It has its own niche, obviously, but it has in the Democratic Republic of Congo caused outbreaks before. So it's not completely new or unexpected, but it's not necessarily something that you think of first with an outbreak of Ebola more recently. So it exists. It as opposed to what we talked about with hantavirus, this does seem to cause a little bit different disease than Ebola Zaire, and in that way, it causes a slower pace disease. It can still get people really sick, as we're seeing right now in the DRC and in Uganda. In the DRC now, we're talking hundreds of cases every day. It goes up, so 500 cases, 130 deaths known about so far, probably more. So it's a little bit slower paced, maybe. I have a feeling there's going to be new data about the viral dynamics of this virus compared to Zaire, which we have a lot of data on. But yeah, but still very deadly, lethal virus.
And some Americans have been exposed to the virus and will likely need to quarantine. Can you talk about what that is like for people quarantining and tests and monitoring of these individuals?
Yeah, for sure. We've heard that unfortunately, there was a physician who was working in a very remote area of the DRC, of the Democratic Republic of Congo, a surgeon who became infected. So he became symptomatic and now has tested positive for the virus. And so that person is being cared for, and I think now is out of the country at a facility in Germany, it's being reported. There are reportedly others who have been exposed but are not sick. And so, what happens when you have someone who has an exposure, let's say a clinician who is examining a patient or doing a surgery or delivering a baby, those people who've been exposed are monitored for any signs or symptoms of having infection. And so they're watched mostly clinically to determine whether or not they become infected. And we think the incubation period of around 21 days is sufficient to monitor folks. So those folks would be quarantined. They would be set, away from anyone else just in case they become infected. It's interesting with Ebola, as opposed to hantavirus, we think that you don't really get enough virus to transmit to other people until you become symptomatic. And that's not an ironclad rule. It's a principle that we believe based upon epidemiology and some other types of data, but not. I wouldn't bet the farm on it. But I would be less worried about someone who said, well, a few days ago I was interacting with someone who, 5 days later was became symptomatic. I wouldn't be too concerned about that person being exposed to Ebola. And again, Ebola requires closer contact than something like hantavirus. But with hantavirus, there are data that people can have the virus in their blood days before they become symptomatic. So again, there may be a window period when you're shedding and not symptomatic. And we all discussed this with COVID too. Remember that people could become infectious before they get sick and even test positive. So with Ebola, probably less likely, but certainly a concern.
And from your experience working in hotspots dealing with high consequence infectious diseases, what should the public know about these situations as it pertains to Ebola and getting it under control?
So this is a big deal for all of us, right? So we remember back in 2014, 15, 16, when we were concerned about this huge outbreak that was occurring in West Africa. I think the reasons we should care about it are multiple. We care about other people in the world. That's important, of course. And there are people suffering, and lots of us talk a lot about the sanctity of life and about children, and we don't want to see this kind of suffering. Number two is we saw during the outbreak from West Africa that there were cases of people who had been infected returning home. And we also saw that a man who is from Liberia came to the United States, was misdiagnosed, and two nurses became infected. So, again, I'm not worried that we're going to have an outbreak of Ebola in the United States. The circumstances by which Ebola spreads um, in Africa are very different than how it could spread here. We just don't have the same sort of vulnerability due to our healthcare infrastructure, public health, etc. Um, but I do think it affects the world. It affects economies. It affects regional security. There's a lot going on in these different parts of the world. We don't want to see this kind of instability caused by disease. So I think getting it under control helps people in the areas that are affected, and it helps us, right? So we want to be able to stop outbreaks where they are emanating from, and that's a win-win, I think, for everyone.